We have some big news right now. U.S. experts are sounding the alarm over the fact that the United States CDC is pretty much non-existent, especially in light of the Hantavirus outbreak. Following the outbreak in the cruise ship, the CDC didn't start public briefings, didn't immediately dispatch disease investigators, didn't provide any timely health alerts to doctors in the United States of America. The CDC has been almost non-existent and hasn't had any or very little public-facing messaging for the general American public. And public health experts say that this is a direct result of the gutting of the CDC that we've seen over the past year. Now, thankfully, the Hantavirus outbreak is not a repeat of 2020, but experts say that this is an example of what could happen because the CDC is so decimated, that without any leadership, without any funding, without any guidance, you could have a repeat of what we saw during 2020. Not with this virus, but with others. And so the alarm is being sounded right now internally. We'll see if this changes the direction of the CDC. I'll have more updates for you soon. Follow along for more.
I'm not one to fearmonger, but we can't let them people off that ship, especially us people in New York City. They got that Hantavirus from Argentina, where they're going to be having multiple games and with the World Cup, and they're bringing that to Kansas City and then to New York City. New York City is not ready for a Hantavirus, okay? We got people who refuse to pick up dog shit from their own dog. We walked around with dog shit on sidewalks and streets all winter long, okay? Not only that, the rat problem, the rat infestation, the way they said that this thing is spread is through rodents and possible person-to-person contact. We got people where you don't even know what type of filth somebody's living in New York City. No tea, no shade. But some people be really living in deplorable conditions in this city and you wouldn't even know it. They just be acting like mouse being in their house is just a normal everyday thing. Rodents being in their house is a normal everyday thing. Listen, New York City is not ready for no Hantavirus. Keep them people on the ship, okay? I'm sorry that y'all had to go through this, but it seemed like you had a great life to be able to afford a trip like that where you're leisurely going to remote islands. Good riddance.
People keep asking whether hantavirus is going to become another COVID situation. Honestly, my bigger concern is that the United States healthcare system and workforce would not survive another major pandemic right now. The current hantavirus situation aboard the MV Honduras cruise ship is getting international attention after multiple deaths and confirmed or suspected infections tied to the Andes strand of hantavirus. That matters because unlike most hantavirus, the Andes strain has documented rare human-to-human transmission. So now, to be very clear, the World Health Organization and the CDC currently say that the overall public risk remains low. So this is not another COVID pandemic at this point. But here's the problem though. The United States has spent years weakening public trust in science, politicizing infectious disease response, exhausting healthcare workers, and allowing hospitals to operate under constant staffing strain. So from a clinical and legal standpoint, pandemics are not managed through politics or social media arguments. They require functioning public health systems, laboratory surveillance, emergency preparedness, supply chains, staffing reserves, and coordination between multiple agencies. And I genuinely do not think or believe this country is prepared for another large-scale infectious disease crisis during active global instability and ongoing international conflict. Healthcare workers are already burnt out. Many left the profession after COVID. Hospitals across the country are still dealing with unsafe staffing concerns, financial instability, overcrowding, and workplace violence. As a quick reminder, during COVID, healthcare workers carried an enormous physical and psychological burden. Many clinicians never recovered emotionally from what they experienced. If another major pandemic occurred tomorrow, I fear the healthcare workforce would fracture even further. So yes, monitor the hantavirus situation responsibly. Right now, international health agencies still consider the broader public risk low. But the bigger conversation should be whether the United States has learned anything about preparedness, healthcare infrastructure, and workforce protection before the next real emergency arrives. Because viruses do not give a damn about politics, budget cuts, or culture wars. Biology continues whether governments are ready or not, a deeply inconvenient reality for people who think defunding expertise somehow makes disease disappear.
Hi guys, how are you all doing today? You're welcome back to my channel. Welcome to Shady Speaks. And here today I would like to talk about the hantavirus. Yes, we all know that there's been a lot of anxiety about this hantavirus that have been going on lately, and a concern for another pandemic reminding us of COVID in 2020. Okay, there's been a lot of posts I've been seeing all over the social media lately about this antivirus, and I've not yet seen any improvement about it, because to me it seems like they are not ready for it yet, because they are supposed to be ready to deal with this. Because when you tackle an issue when it started, before it spread out and go very wide, you have a cure of it. But as it's going on right now, I don't really think the Americans are prepared for it. Well, do not reflect my personal opinion on my comment, and don't forget this video is for educational purpose only. It's not meant to harass any individual. And don't forget to like, share, and subscribe. I have some few clips and stitches I'll roll out for you guys to watch, and then we'll be back with commentaries. Stay tuned guys, we'll be back.
Right now, I'm very sorry to say that we are not prepared. We have seen large-scale funding and workforce cuts made in the last year, not just to the Centers for Disease Control and Prevention, but to global health. Our withdrawal from WHO, our decimation of USAID, and also cuts to scientific research, particularly the development of mRNA viruses, and to public health. So all of these things are having really profound ripple effects. And as Carla said, this is a situation where you really are seeing crystallized the need for biopreparedness.
A lot of the things that you would like to see, we haven't seen. And to me, that's very concerning, that the silence that we're seeing from our premier public health institution is really concerning to me. We would then not uncommonly have a team from CDC deployed to that area to provide technical assistance, to help with epi tracing, to do interviews, to do, obtain samples, to do many of the things that are necessary in order to really investigate the outbreak.
Amid the Hantavirus outbreak, experts are raising concerns about our country's preparedness for public health threats under President Donald Trump's administration.
It's very much, we hope, under control.
A reminder that World Health Organization officials have assured that this outbreak is not a pandemic and risk to the general public remains low. But still, news of the potentially deadly illness is reminding many of the early days of COVID and prompting worries about potential future pandemics. The CEO of the Infectious Diseases Society of America said that we are not prepared when it comes to public health crises due to the administration's large-scale funding and staffing cuts, withdrawal from the WHO, and more actions that weaken public health.
And right now, I'm very sorry to say that we are not prepared.
Dr. Celine Gounder, a physician who specializes in infectious diseases and global health, called on the administration to be more transparent and communicative, saying that the government's silence on hantavirus is, quote, unacceptable.
I hope not. I hope not. We'll do the best we can.
You've been briefed on the virus.
Yes, I have.
Can you tell us what you learned in these briefings?
Well, I think you're going to be told everything, and you already have. It's very much, we hope, under control. It was the ship, and I think we're going to make a full report about it tomorrow. We have a lot of people, a lot of great people are studying it. It should be fine. We hope.
Should Americans be concerned that it's going to spread? And how are you
I hope
looking to
not.
get those
I hope not. We'll do the best we can.
Well, welcome back guys, welcome back. We can see from the few stitches and clips I just rolled out for us to watch now, I believe that has told us a lot about how these Americans are not yet prepared to deal with hantavirus. Yes. But here are the facts. We know that the Andes strain of hantavirus can be transmitted from individuals. Yeah, between individuals, individual people, and there have been previous outbreak in the United States with more than 800 cases, reportedly since 1993. You know, I thought about this. I was imagining that if this antivirus have been happening since 1993 till date 2026, and the issue have been tackled up yet, like why? What are they waiting for? You know, they can't just, the US, the president of the US and the medical department, the WHO, World Health Organization cannot just sit on their seat and fold their hands and do nothing about it. That doesn't sound serious at all, because they are supposed to deal with it. Not until it's spread widely all over the world, all over where it goes. That's not when they are supposed to start dealing with it. They are supposed to start dealing with this issue right from the upset, from the start. And yeah, I don't want to hear this antivirus started from Africa or wherever. No, it started in your country, so you have to deal with it, because we all know how these white people act. When they see they don't have control over it anymore, they find a way to put it on the black people's head. Yeah, not just on black people's head, or try to find another country and sum it up with it that it started from there. No, it started from your country, so you have to deal with it. So this is it, guys. Drop your thoughts in the comment section. Don't forget to like, share, and subscribe. Credit belongs to the original creator of every single clips and stitches. Stay tuned, guys, and watch out for my next video. Thank you and have a blessed day. Bye.